Did you know that nearly 60% of adults report experiencing at least one traumatic event in childhood? Shocking, right? These early experiences can affect how we love and connect with others as adults. Childhood trauma can feel like an invisible backpack we carry into our relationships. Many people don't realize how deep this impact can go. For example, research shows that those with unresolved trauma are over 40% more likely to face relationship problems. They often find themselves repeating unhealthy patterns, choosing partners who reflect past pain instead of joy. It's a cycle that can feel never-ending. But it doesn't have to be this way. In this article, we'll explore how childhood trauma shapes adult relationships, from fears of intimacy to the urge to push loved ones away. We'll share real strategies to help you break free from these patterns and build the loving connections you deserve. Whether you're struggling in your relationships or simply want to understand yourself better, this journey offers hope and healing. Get ready to uncover the truth about your past and learn how to create the future you've always wanted. Let's dive in. Chapter 1: The Hidden Echoes: How Childhood Trauma Silently Shapes Love. Childhood trauma isn't something that just goes away. It leaves traces that follow us into adult life, especially in relationships. Research shows that 60% of adults with unresolved trauma are more likely to repeat unhealthy relationship patterns. You might ask, but how does this even happen? Trauma alters our brain's development, particularly in areas like the amygdala and hippocampus, which control emotions and memories. One way this manifests is through heightened sensitivity to perceived rejection. For example, if you grew up in an environment where love felt conditional, you might become hypersensitive to any hint of criticism from your partner. This feeling can be intense and often leads to overreacting or pulling away to avoid pain. Psychologists call this rejection sensitivity. It's a defense mechanism, but it can harm relationships. Another subtle way trauma shows up is in expectations. People with unresolved trauma tend to expect either too much or too little from their partners. For instance, some might expect their partner to fix them, while others feel undeserving of love and connection altogether. These expectations set up a difficult dynamic that's hard to change without conscious effort. A first step to breaking these patterns is by learning to identify them. Take a moment to ask yourself, do I tend to expect my partner to behave a certain way or fear rejection in small interactions? Once we recognize these patterns, we can start making changes. Journaling or therapy are powerful tools to dig deeper and track our responses. Chapter 2: The Inner Child's Cry for Help: Recognizing Unseen Wounds. We all carry an inner child within us, a part that holds onto our early experiences. When trauma from those years remains unresolved, our inner child tends to seek validation or react defensively in adult relationships. Have you ever felt sudden, intense emotions that don't quite match the situation? That might be your inner child reaching out. Research by Dr. John Bradshaw, a prominent psychologist, suggests that acknowledging this inner child is essential to healing. According to his findings, ignoring or denying our inner child can worsen relationship challenges. For example, someone whose parents were emotionally unavailable might crave constant attention from their partner. This can strain relationships, as it leads to clinginess or resentment if expectations aren't met. An interesting strategy to connect with your inner child is through guided visualization exercises. Imagine your younger self in a safe space and mentally reassure them. This can sound odd, but visualizing comfort for your inner child can have calming effects on your current self. Studies show that regular visualization exercises can lower stress and improve self-esteem, both crucial for healthy relationships. Another effective method is writing a letter to your younger self. Express understanding and compassion for what you went through. This exercise not only provides emotional release but helps you realize that those experiences, while formative, do not define who you are today. Over time, this can reduce the power your inner child holds over your adult reactions. Chapter 3: Love on the Edge: Why Trauma Makes Us Fear Intimacy and Vulnerability. One of the most common outcomes of childhood trauma is a fear of intimacy. Trauma survivors often feel exposed or unsafe when opening up to others, even when there's no logical reason to fear harm. Dr. Judith Herman, a leading trauma researcher, notes that survivors often organize their lives around not being vulnerable, leading them to keep emotional walls up. Interestingly, 1 in 4 adults with a history of trauma has a form of avoidant attachment, a tendency to distance themselves emotionally. They might believe that depending on others is risky or that getting too close will lead to hurt. This thinking can block the deep connection they crave, setting up a painful cycle of isolation in relationships. To overcome this fear, practice gradual vulnerability. Start by sharing small things with your partner. For example, talk about a minor challenge at work or a memory from childhood. This can build a bridge of trust and open the door for deeper sharing. Remember, vulnerability is like a muscle, the more you use it, the stronger it becomes. Mindfulness can also be helpful. Practicing mindful breathing or meditation can teach you to stay present and calm, even when intimacy feels scary. According to a study in the Journal of Behavioral Medicine, mindful practices reduce stress and anxiety, helping you feel more open to emotional connection. Lastly, if you find it hard to lower your guard, let your partner know about your journey. Explain that vulnerability feels challenging due to past experiences, and you're working on it. Many partners appreciate this openness and are more willing to support you through it. If you found this chapter helpful, subscribe to our channel for more insights and strategies to navigate your relationships. Chapter 4: The Self-Fulfilling Prophecy. Breaking free from cycles of toxic love. When trauma is left unhealed, it often creates a loop of toxic relationships. People with early trauma can find themselves drawn to partners who repeat familiar patterns, even if those patterns are unhealthy. This is called repetition compulsion, a term coined by Sigmund Freud. It's when we subconsciously try to recreate situations that mirror our childhood in the hope of finding resolution. In fact, a study from Psychology Today shows that individuals with a history of trauma are 47% more likely to enter relationships with partners who reinforce negative patterns. But why does this happen? When we're used to a certain kind of dynamic, even if it's toxic, it feels normal. Breaking out of this cycle starts with recognizing what a healthy relationship actually looks like. A useful first step is listing the qualities you want in a partner. This sounds simple, but it's powerful. When you have clear standards, it's easier to see if someone aligns with them or not. Be honest with yourself about what a healthy, loving partner would look like, even if it feels foreign or strange. Another strategy is called opposite action. If you tend to chase emotionally unavailable partners, try going for someone who shows genuine interest and is emotionally open. This might feel uncomfortable at first, but that discomfort is a sign you're breaking the cycle. This technique is based on dialectical behavior therapy, DBT, which shows that small changes in behavior can lead to major emotional shifts over time. It's also essential to work on your self-worth. Trauma survivors often feel unworthy of healthy love, so they settle for less. Daily affirmations or mirror work, simply looking at yourself and saying kind words, can help. Louise Hay, author of You Can Heal Your Life, emphasized that self-acceptance begins with self-acknowledgement. The more you tell yourself you deserve love, the more you start to believe it. Chapter 5: Building the Love You Deserve. Steps to heal and rewire. Healing trauma doesn't happen overnight, but it's possible with small, consistent actions. Studies show that just 10 minutes a day of trauma-informed practices can have a lasting impact. These practices are designed to calm the nervous system, which is often in overdrive in trauma survivors. One example is grounding exercises. Grounding exercises help you focus on the present moment, reminding you that you're safe. Try the 5-4-3-2-1 technique. Name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This method is recommended by trauma therapists worldwide as a quick way to reduce anxiety. Meditation is also a powerful tool. Trauma-focused meditation involves sitting quietly and observing your thoughts without judgment. This helps you notice negative thought patterns that might be fueling relationship struggles. According to a study in mindfulness, trauma survivors who meditate show reduced symptoms of anxiety and depression by up to 45%. A major step is rewiring your beliefs about love. If you grew up in a home where love was conditional or chaotic, you might believe that love is supposed to be difficult. Start by questioning those beliefs. Write them down and challenge them with examples of healthy love you've seen in friends or even in media. A book that dives into this is Attached by Amir Levine, which explains how our childhood experiences shape our attachment style and how we can change it. If you're open to therapy, consider EMDR, eye movement desensitization and reprocessing. EMDR has been shown to effectively reduce trauma symptoms and help people reprocess painful memories. Over 30 clinical trials confirm its effectiveness in trauma treatment, with an average success rate of 77%. Working with a certified EMDR therapist could be a game changer in breaking painful cycles. If you enjoyed this journey and found these strategies helpful, don't forget to subscribe for more insights into love, relationships, and personal growth. Join us as we continue to explore the path to healthier connections and lasting happiness.